Greetings. We are live. Welcome to episode 14 of True Health Live. I am joined by my co-host, Precious Stephanie, healthcare executive, and Anushka Gopalal, public health professional. Alia will be with us shortly. She had a family event that is so awesome, which we'll be talking about in future episodes. So right now, it's just the three of us. And today, we are going to be talking about health equity. It's something that everybody's talking about. It's all over public health, the public health zeitgeist and universe. It came to the forefront with COVID, and we've always been saying that COVID did not invent the issue of health disparities and put it and it just kind of shone a light on the health inequities that are present. So we just want to have like a candid conversation about health inequities or health equity, as you will, to okay. I thought we had movement in the chat. So we just want to have a chat. This is where everyone is. So thank you for joining us, whether you're on YouTube, Facebook, because I think it's on two Facebook channels. But if you are on Facebook, make sure to come on over to the YouTube space and subscribe to the True Health Live channel, and we can talk to you there. If there are any comments or whatever, we'll definitely engage in real time. So ladies, what's up? Let's chat about this health equity. We know what it is, right? It is making sure that not that people have equal. Let's be clear about equality and equity. Equal means the same amount, but health equity is ensuring that everyone has what they need to access, healthy living lifestyles, to access what they need to achieve and maintain the highest levels of health. So I'm curious to know like how you ladies, because I always start off and I'm like doing this talk and monologue. You guys take it over. Like, what is happening? What have you noticed, or what are some of the things that you want to share when it comes to health equity in your respective fields within public health? What have you been doing?
Sure. So maybe I'll jump in. I'm happy that we're, digging into health equity. In my mind, it always links with the idea of social determinants for health. And I wanted to just at least outline what some of those social determinants are, right? So the access to nutritious food, to housing, level of education, and access to adequate education are just a few. The healthcare services that are available in your area, all of these things contribute to, the social determinants for health, which then leads to how well or how equitable the health in your area is probably going to be. So I wanted to kind of give that as like a bucket that we can kind of build on or add additional things into. And then I'll get into, of course, what that looks like in the mental health arena.
Anushka?
Hi, everybody. What haven't we seen, right? In regards to the inequities, I think I'll just focus in on the pandemic since we're in that time right now. But during this time, what I've witnessed on a larger level for like community is really just the access to healthcare providers. Because at one point, we were all in the house, we couldn't get to our doctors. Telemed for some was just so brand new, people could not navigate through it. And especially for like our elders, who are not so tech savvy, and getting on the video chat or even just the phone call, it took away that personal experience. And some just didn't feel like they were getting the adequate care that they wanted, they needed, and they deserved. And so when things started to open back up, I feel, they were thrilled to get back in the office. But then when you got in the office, because, all of the guidelines and so forth, a lot of times what I've heard was that folks would be in doctor's offices just waiting for like hours on out. And then when you finally get to see a doctor, it's not always your own doctor that you've been accustomed to seeing. It's like everyone is scattered everywhere, trying to get you here, trying to get you there. And then when you do get in front of them, it's like a quick run through. It's
Mm-hmm.
not taking your time and really asking questions. How are you doing? How have you dealt with these things? How have you coped? What's going on? What's new? Because I haven't seen you X amount of time. So it's like the process has just been rushed. So it went from not seeing a doctor to then finally being in front of one, or a provider, I should say. And then the process was just like that. So it's in and out, in and out, in and out. So where's the quality of care
Yeah.
that people were getting? And I emphasize on the elders because I think like they are so vulnerable, especially with if when they have all these chronic diseases. And those were the folks that I was talking to and I heard from. And so I was just so surprised that the care was not given on a much more like had more personal and more tentative for
Yeah.
them, because they needed so much and they have so many questions. Not to say others didn't, but I think, you have to use your discretion and take things a little bit slower, for certain folks, especially if they have multiple illnesses that they're dealing with. And I just think overall, I think overall, when people were able to talk to their providers and whatnot, it was still a curveball. So it was a lot of getting through all the things that have happened and transpired, um, and really just getting to the nitty gritty.
Mm-hmm.
Um, and it was tough getting appointments because everybody was getting back to it at the same time.
Yeah.
So it became a little tough just to even get in front of somebody or on the phone to get you there.
Yeah. And
Yeah.
you mentioned like the telehealth. We check out episode 13, which talks about talking telehealth. And not you're right. Not everyone had the resources to access telehealth. Like, Precious and I went over, the fact that the idea of telemedicine, which people use interchangeably between telehealth and telemedicine, but telemedicine is the actual use of like technological services, and telehealth is usually like the actual platform. But definitely check out that episode where we go really deep into it. But we went over the fact that the idea of telemedicine is not new. It is, the pharmacist and the doctor speaking on the phone, calling in your meds, and you going to pick up, or all of those, those correspondences via telephone and things like that, or things that have been faxed or whatever. So the idea of telemedicine is not new, but the depth into which we're using it now, and the integration of like more like as technology advances, that's what's changing. But not everybody, elderly don't necessarily use the computer, the internet in the same way that younger people do. And also depending on which generation you are, you're not using like how many people who are now millennials are all over like TikTok and things like that. Like, we kind of come into it a little bit late. We're probably on it. We're definitely on it, but we're not as, quick to the draw like Gen Z is, So everybody's kind of like at their own speed, and not everybody has the resources as well. So like you're right, like the telemedicine is a big deal. But Precious, you mentioned something about like the housing. Like this is like such a big deal. So, and I know like, with the facility that you work at, the hospital, like housing is something a part of the things that you have like kind of in your purview. Can you elaborate on some of those things?
Sure. So when we think about social determinants for health, which is one of the it's a contributor for health towards health equity. So working with the SMI population, or the significantly mentally ill population, um, there's housing bias, right? It's kind of like working with the criminal justice population, or in some communities, working with people of color. It's like, not in my neighborhood. We don't want it here. We don't want them here. And so a big challenge has always been advocating for policy changes and incentives to ensure that the mentally ill population have adequate opportunity to housing, that they don't have to stay in a residential facility that's maybe state operated or operated by a local nonprofit organization, only because there is a dearth of appropriate housing in the community to support their needs. So that's one example. But to kind of take it to, I guess, maybe to make it more relatable to those that may not suffer with mental illness or have loved ones that do, we can just think about the appropriate equitable housing in some of our neighborhoods. You know, when you think about, I mean, I used to live in Brooklyn, and when I think about what the options were in Brooklyn, then I'll say in the 90s or early 2000s, and then me visiting Brooklyn now, and those same buildings that were $500 $600 a month for rent are now $2,500 $3,000. It's like you can't even get into these apartments
Yeah.
anymore. So where do you live? But then with the proliferation of folks moving from Manhattan into Brooklyn and creating the opportunity for greater rent, then you see an infusion of healthcare systems and healthy
Whole food.
food options and, farmers markets. Those are the things that contribute to social
Mhm.
determinants for health and well-being. So when you see those things kind of move with the population, it gives you a sense of what's needed for us all to have equitable access to healthcare. So I
Yeah.
want to make it like real life. Go ahead.
Yeah, and it also shows the people that were there, because let's call it what it is. A lot of that is the result of neighborhoods being gentrified, and it shows the people that are there like, oh, this is what you really thought of us. So we don't get the healthy foods until others move in. So there's a value placed on people based on what their culture is, what they look like, and we know that that's what it is. And so then how do we have those conversations with people who are benefiting? Because the truth is, it's not just people who are not people of color who are benefiting. Sometimes if you are part of that group that is fortunate enough to make a certain amount of money, you're kind of moving in that circle too. Like, let's be honest and call it what it is. Yes, it is more overwhelmingly people who are less melanated who are benefiting, but some people who are in a different economic bracket, because a lot of it has to, when we talk about social determinants of health, a lot of it has to do with also socioeconomic status. That's all kind of like wrapped in there into one. And there are people who are melanin rich or melanin dominated who do fit into the high socioeconomic status brackets, because there's the education, there's the income. We ain't gonna talk about the debt, but there's the education and there's the income. So you are able to kind of take advantage of this booming housing market with all these houses that are for sale, even though um there's like not enough to go around, and like it's kind of like we're backward. There's also apartments that you're able to, like, maybe New York City has a lottery, maybe your numbers coming up in the lottery a little bit more. I remember like having at least 2 to 3 lottery hits, and it was like, okay, well, here's the rent, and I was like, are you serious? Like, who's calling this affordable? Like, what? What are you talking about? But it doesn't mean that I wasn't able to afford it. It was more like, what my choices are. I had the option of refusing it, right? But not everybody has the option of doing that. They kind of just can go where they can afford. So yeah, like, it really shows like the kind of value you put on the people when you don't have this equitable way of housing. um Shelter, what people need: food, clothing, shelter. And this is shelter. So it shows me like how much you value me, and a lot of the time when we saw during COVID, these are the people who were keeping the city going a lot of the time. These were your frontline people. Not all of them had to be medical workers. These were your garbage men. These were the people that work for utility companies. And it's like they're keeping everything going, but this is how you value them. So, that's maybe another show. Maybe we'll invite someone who is on the front lines every day. Because let's be real. Some people never stopped working, and we're not just talking about people who are in the medical and health field. Right, right. Some people, I never stopped, but some people were like still at work, like not even just like working from home. Some people were still out in the streets, still out in the street. You
Yes.
can't see my arm, but it's going over there, still out in the streets. So, we have to be really, really cognizant of like how how they're valued and how they even perceive how they're valued. So, yeah. And all of that
Yeah.
feeds into health equity. That feeds into the psyche, to the
Mhm.
mentality. You know, how a person, and if they're stressed out, it feeds into how they eat, how they continue eating habits and whatnot. So yeah, these are all things we have to think about.
Absolutely. And that just goes into whole like it's all different levels, right? Of the impact that all this makes. And in terms of like, the community and the housing, can you just imagine that you grow up in a particular, like Brooklyn, we'll say Brooklyn, you grew up in the neighborhood, your parents grew up there, your grandparents grew up there. So like a whole family, right? A whole bloodline was raised in that particular community.
Mhm.
And then got driven out, right? And then you see
Yeah.
all these newcomers coming in and taking over, and now you have all these options of a better
Hmm.
lifestyle, better living, better eating, and it is a slap in the face. Like here we are, all these generations in, and you've made it so expensive that we can't even stay here. And you know what? Another thing is to get more people to come in. What I saw that they were doing. One of my daughter's friends mentioned it, they're like buying families out at a
Hmm.
particular dollar amount, and you know what I mean. But then when you think about it, if I've lived here, my family's lived here for over 50 years, right? So we're kind of, and some people have already owned their homes. But if you decide to take that money and move, you're like, okay, but now you got to face what market value is if you buy or go into an apartment now. And it's just like, is it even worth it? Because and they do all these things to like, to get you to buy in and whatnot. But it's beyond just a slap in the face. It's so insulting. And the fact is, like, we're raising the issues, we're talking about it, but it's what do we need to do to prevent this? What protection do we protect those people who have been there for generations on out? How can we change this so they don't get ridden out, like it happened in Harlem? It's happening everywhere.
It is.
And it's just like, all right, enough is enough. Like, it's so unfair. um and yeah, and one thing always leads to another, right? Because
Mhm.
if you're worried about rent, or you're worried about losing your home because of the gentrification and all these different changes, you're stressed out. Stress leads to illness, or you can people start eating because that's the way you cope, and then obesity, and you know what I mean. Like, it's all these different things that trickle down. It's not just one and it stops there. It just and it doesn't stop with just you. It goes on to your family. Like, if a parent and your children mimic what they see, you know and if you're the one preparing the food, then it goes down to them, because whatever you eat, they eat, type of thing. So it takes a toll on the whole family, not just one. And that's when things start going downhill. And then I think even deeper, I'm like, well, was this the plan to begin with? Like, you know what I mean? Just to take us out one by one, and like level by level. So it's a lot that we think about, that we have a lot of work that we have to do, but we continue to do this work. When is it that we are going to make like a solid change and stop the BS,
Yeah.
and
That's
make it
such a
equitable?
Oh, I'm sorry. I think that was such a great question that you posed at the end, and earlier in in what you just said. It's like, how do we stop it? Right? As I listen to you kind of go from generation to generation, and you're at the point where perhaps you own your home, and so you're not really, thinking about your property value. You may not be thinking about, what the market value is. And I remember someone said to me years ago, when someone considers selling, think about whether you can buy that piece of property back in 1 or 2 years with the money you would have gotten. And the answer is always going to be no, because if you're in a thriving, if your property is in an area that's thriving, your value is consistently increasing. Even if it takes dips, it's going to continue to increase. And it's interesting that we're going all of what might seem like all over the map with a discussion on health equity. But I like how you connected it to stress and, depression and increased blood pressure and all of the things that take one thing, and then it kind of feeds into all of the health challenges that we can dig into. And just for the audience, I wanted to just kind of again give a sense of what health equity is. To me, this isn't a formal definition, but it was just something that, based on listening to us all discuss, it's like it's an equitable distribution of services based upon need. So
Mm-hmm.
equality, right, is just saying, well, you get one doctor, you get one doctor, you get one doctor. Everything's
Right.
fine, right? What's the big deal? Except I have 12 health care. I have 12 health issues. That one doctor is not a specialist for those for all of the things that ail me. You
Mm-hmm.
have, a litany of problems and challenges with maybe work. So that one doctor isn't going to help manage your stress or be the therapy that you need. And perhaps Anushka is the only one who really benefits from that one doctor. So that is the difference. And hopefully you get the picture I'm trying to paint. That's the difference between equity and equality.
Mm-hmm.
The services need to be rendered in an equitable fashion based on the need or the preponderance of needs that one has or a community has.
Mm-hmm. Yeah.
Yes.
So, and there's those drawings, and I'm sure at this point a lot of people have seen them. Like I've seen the apple tree and the baseball field. There was one time I was watching like the Oscars or something, and they actually had like a very subliminal message about equity, where they had these two. It was the year that I guess like these movies came out where there was two young actors that they were in movies that had both been nominated, I think, for like best film. So like they have people come out and present. So they were the two young kids, and one child was like very little, and the other one was tall. Like they might have been around the same age, but one is taller. So the height that the microphone was at, one of them could reach it. So Chris Rock, I think, who was host at the time, he comes out with a little box, like a step stool box, one for both of them. He adjusts the mic at a height to this equal height. One gets a smaller box, the taller young boy, and the one who was the tiniest, he gets the bigger one. And so at that point, when they both step on their individual boxes, they both reach the mic at the same height. And I was like, this is like perfect. I'm like, why? It was an example, like a real life example of equity, like in action and how we make it happen. Whether it was health equity or it was just equity. And I was like, that was very subliminal. I wonder why they weren't just more overt about it. Or maybe it was overt, but like there just wasn't any kind of preface to it. He just came out with the boxes, and I was like, that's interesting that they did that. I think I recorded it. It might be like way back in the Instagram file somewhere. I don't know. But it just goes to show that like not everybody needs the same amount. Nobody needs the same amount, because we're all inherently different. So what we individually need is going to be different. So you can't give everybody the same amount of something, yeah. There was something that one of you mentioned. I wanted to kind of go into the hypertension, like the kind of the negative health outcomes that come from like the stressors of like housing. This is where we get into like the health equity, and like what it kind of breeds, right? So when we think about like the stressors, like what happens, like you said, and there's like you eat more. I was like, you smoke more. Then like what happens with depending on what you eat, and we know like some of those things create hypertension. We know that smoking is a risk factor for stroke, and heart disease and cancer. And we know that heart disease is the number one killer of Americans, right? Of people in the US, and especially Black men. So when we think about like, the inequities of that, and then they die more from it. So when we think about like the inequities of things like heart disease, why are they dying more? Because maybe they're not getting the same care with doctors, because they don't necessarily go to the doctor. And I think I talked about this with another podcast. I did, with another podcaster. We gotta talk. So check her out. Um, they're not going to the doctor in the same amount of time, the same fashion. And we know that that's an issue and we understand where that comes from, is the mistrust of the healthcare system. At a point though, we do have to evolve, right? So that we don't necessarily have these equity issues. So it comes on both sides, where there has to be this evolution and understanding, like I have to advocate for self first and take care of my health. At the same time, there needs to be like, when we as public health professionals, when we're talking about health promotion and prevention of disease and prolonging of life, there has to be a real and authentic way of engaging communities so that the message resonates with them and that it's relevant and they feel safe to engage, right? Because like if I don't feel safe, then all of these behaviors and the things that plague the community are going to continue. And so I think like that's what we see. Like there's slow movement in places, but not as much as we would like to see. I would say as health professionals, like not as much as we would like to see, because if we did, we wouldn't still be having a lot of the same conversations that we've been having from year to year to year. So I just wanted to like point that out. Like, the all of these things, these risk factors and these negative health outcomes, they lead to another, and that one leads to another, and that one leads to another. And then we just like end up like in the same cycles. So like even in the health equity, we have to be equitable in even how we educate, Not there can't be like a blanket statement or message for communities. And just because you translate it into a different language, that's not going to cut it either. You have to have people that look like them. And we know this, right? Like people have been making those moves, but there's still some sort of disconnect where, you don't necessarily see the movement as quickly as possible. Like again, because we having these same conversations every year. So yeah.
I think about the idea of education, um, from every vantage point, and we always get back to educating and sharing information, particularly with not just our youth, right, but also our elders, because it's almost as if we have to always think about who's being preyed upon, and then make sure they have enough information to know when it's happening. And we know that our youth and our elderly population are usually the two domains that tend to experience that. So when you think about selling the homes, and I know Nishka gave the example of what happened in Harlem, it happened in Brooklyn as well. There's this, unfortunately, that middle group, right, the young adults, we lose value and investment in those homes and in those communities, and we think that there's something better somewhere else, so we move far away or we shift to another state. But our elders are there maintaining until they can't anymore, and then that's when the offers come in. And one by one, the community is gobbled up. And, so it's really about understanding the value and educating. If we don't do those things, then this continues to be the dialogue that we have. When we begin to come together and have talks like this and share information, it's in an effort to empower. Oh, shoot.
We got you. Oh no. Okay, well she'll come back. Um, but yeah, like let me just like keep it moving. So as you said, I agree. It's in an effort to empower. And I think like, one thing, and we'll wait till she gets back, like for her to finish her point. But when we think about community, like the first thing that came to mind is community. And this is True Health Live, and there's not been one show where we don't bring up the issue of community, because we're gonna drill it into everybody's head. Community, community, community. It is something that we definitely have to establish and maintain. And I say establish because I think a lot of the times, like we're moving in this space where we think we have community. I hear a lot of people talk like when they're like, yeah, we got to do this for the community. What community? What community?
Hmm.
Really have community when within the same communities people are trying to kill each other? I'm sorry, but that's not a community. I know the culture that I lead and the life that I live, we have strict guidelines. It's like we don't kill one another. We are like,
Hmm.
community is also like your larger family. The insular and nuclear family, like within the home, is just a microcosm of the larger community, which is a larger piece of family. So like you don't kill one another. So if those things are still happening in communities, then you have to really take a step back and think like, is it really a community? Right. So then we go into like, when we see elders being preyed upon by like sharks, I don't know, housing sharks, real estate sharks, whatever, developers, who is it that's going in to help and advocate for them? Who's doing,
Mhm.
are we doing that? We're not, and maybe some people are, which is a great thing. But if it's not happening in mass, then there's not necessarily like a lot of change that we're going to see with that happening. So I think yes, and we are back. Welcome back. Like, whatever. We have we in the technology age, and like things happen, so we're just gonna keep it moving. You were talking about like the elders, and when they're leaving their houses, and like I guess when those sharks go prey upon them, they're like, okay, we're gonna go, and that's how they move in. um so if you pick it back up, and we kind of veered into community, because I'm like, I think this is where she's going with it, like, how this is where we have to make examples of community establishing and maintaining, and like being very clear about what that is.
Absolutely. That was exactly. And, I'm going to assume that, my computer didn't want me to get out the message. But yes, it's about, understanding what community is. It's important for us to gain knowledge, but we have to be rooted in a value system. And so oftentimes we don't have true community. And so then we think everything that's valuable is outside of our rooting, right? Our footing, or our foundation. And we sometimes discover after the fact, after our loved ones have sold, we sometimes have sold their homes or sold their land. I've heard given in some examples. And it's like we have to understand how important these things are. One, for the bloodline, as Anushka touched on, but also for legacy building.
Yeah.
And in having that community, you're so less stressed out because you're working together towards a common mission, and vision. So yeah,
Hmm.
that was where I was heading.
Yeah. Yeah.
That's awesome. I'm glad you touched on that and geared it back to community. Since this is true live, true health live, I'm gonna gear it back like a little. Like we talk about, community, and that we've all been saying you have to be able to identify what community is. Me, I feel that community starts at home, right? On a clean slate, on your foundation. What we do in our homes as adults and teaching our children, that's when the sense of community starts, right? So we are not to hurt each other. Don't be envious of one another, right? We're a unit here. We uplift each other, we encourage each other, we empower one another. If I can help you, I'm going to help you. Where you lack and I excel, we're going to make a perfect match, vice versa, right? All that teaching, all the value and the morals, all of that goes into us as a family first, right? No matter what our family dynamics are, right? It could be a blended family, whatever the case may be. When you have that in you and it starts at home, you can then identify a larger community. Like my neighbor is part of my community, right? Um, and that's when the mentality goes like the same way I'm not going to hurt my brother and sister within my home. I'm not going to hurt my neighbor, right? I'm going to help my neighbor elevate, and they're going to look out for me in the same way. And I know back in the days we had that, and now it's a lot more difficult to have that now. But the more we build our foundation in that way, the more our kids, right, can take that out in the world with them and carry that on. So it's helping my neighbor. We're not going to kill each other because this is my community, and each one teach one. If I do well, we all do well because I'm going to show you how I did it. You're going to show me how I do it, how you did it. And if I need help, I know who to lean on to help me do that. And one great example I have, because one of my community partners and I were talking, and she's older, and but she is a pioneer in the community. And she was like, back in the days when I was sick, the lady down the block, she worked on the corner store. She owned like a bodega or something, if I'm not mistaken. She watched my daughter while I was sick. And she knew her so well from the community and everything she was doing. And, that when she got sick, she was able to help her. And it was a trusting environment. It was trust there. It was family there, right? And this is not someone who's part of her nucleus. It's her neighbor, right? Slash her sister. And so community becomes family. So that's why I emphasize what we are taught in our households, we carry on in life. And so if you want to lead by example and you want your children to carry on, then the foundation you lay, the things you practice in your home will then go out into the world. And then your community is even getting enlarged. And the actions within the home will get replicated, right? And that's how you start building outside of the home, and that's how you create unity, and people working together, right? And so like if I see my elder neighbor who's 70 years old needs to get to a doctor or can't navigate through telemedicine slash telehealth, I can step in and do that, right? Or if I see, you know, that they're stressed out, and if I see them on a day-to-day basis and then one day something looks off, I'm able to identify that. I can then kind of intervene in a, respectful way to say, I think something looks different. Let's check this out. Let's see what's going on. Rather it be an elder or not, but that's, to me, that's part of community. That's being able to step in and step up when your fellow brother and sister are down or they can't help themselves. You can lend a hand to help in every aspect. You can help in education if they can't, if the kids are still are on Zoom and they're like, they're doing the online for school, and the parent is not so, so fluent with the technology, you can step in and help, right? It's all these different things. It can go into education. It can go into all the environments, as I call them. Like, so it could go social, education, economics, healthcare, and food. I have them written down. That's what I'm looking over. We can help one another, right? We can definitely help one another, and create and have a holistic community where it's
Mm-hmm.
not backstabbing, where it's not like I'm envious and I'm going to set you up type of thing. But that comes from heart and mind, I feel, and how you take the smaller community, which is your home, your household, how you move there, I think will then indicate how you're going to move in your larger community with your neighbors and so forth.
Yeah. It's like being in tune with the community, right? And then
Hmm.
to identify like where the partnerships are, who are the influential people that will help us like band together in the spaces that we need to kind of get what we need to make sure that we can all function properly. Yeah. And
Right. And knowing how to start those conversations, like
yeah,
in partnership, right? And
part.
not only talk about it, but be about it. So you can't
Mhm.
just go like this and it sounds good. It all sounds good, but you have to hit the pavement and do that work. And as you do that, you're making impact, you're making change, and you don't keep it all for yourself. You teach the next person how to do the same, and sustain it, if not make it greater than that, because it's never going to end. We all know that inequities are not going to end if we don't stay 10 toes down and stay focused on it. When we are holding people accountable and we are making these impacts, and it's positive impact, we need to thrive, continue to strive through that, and as we thrive, it's going to cause change. But we need to make sure we have others with us that are coming along and doing the same thing, if not doing more in our
Yeah.
absence.
Hmm.
Yeah, I definitely agree, right? I think when you take one, what you spoke to in the show, which is family, right? What does the core look like? Is there balance and health and equity there? Does everyone have a role and a vision and a mission within that family? And then how do you take that, as Sister Deidre said, and make sure that you are in tune with the needs of your community? What is your community, and what does it need? Because if we're all on a similar block, since we're sticking with this idea of like health equity, and gentrification, because this is pretty much where we've gone with the dialogue. um, do you have a community board, right? Who's representing what's happening? Are you taking your little backyard or front yard garden and finding a space to clean up and make a community garden? Perhaps it starts there. It's not necessarily always about a talk or a lesson or a class. It's really, like you said, it's about being about it, not necessarily talking about it, but really walking that walk and being an example and then sticking with what you're doing, so that people see the longevity and the value of being committed to it, which then creates a greater value for your community and your neighborhood. Those who intend to kind of ensure that you don't have the services that you need will realize that you're unified and that you will advocate for yourself and have the access to the services you need. If you can't get a doctor's appointment because it takes 2 months for you to see a specialist, why is that? You know, why would that be the case? And how do you speak up for yourself and ensure that people appreciate that, providers appreciate that there's value in this community, and we shouldn't have to travel down yonder in order to receive equitable care. Um, so yeah, definitely community is paramount to getting to
Yeah.
health equity.
Yeah. Yeah, because I think when you have that community, you create those pillars and the foundation that you talked about, and it's because you have those foundation, and it's maybe family, and all the other things. You have your families, you have your housing, you have all the things that you need, and that's what you can make to have that like power pack punch, and then you start advocating for yourself. Like if you're sitting inside of a larger construct, that's what you use when you have those pillars, those necessary pillars and that foundation. Then you start advocating for yourself, to get what to make sure that you can maintain what you need. And I always have to put like the advocacy piece in there, because that's the that's the world I come from. Like when we talk about, we can't just, as a good sister, my laba laba laba, we can't just like, continue to talk. We have to walk the walk, because there's all this information and knowledge that we have, but unless we are doing, right, you have to manifest that knowledge and put it into action, then we're not really going anywhere. Then what are we doing? Do we understand what's happening? Probably not. So we have to like kind of get the boots on the ground and like talk to the community, engage with those who are underserved, engage with those who are vulnerable, help them build those foundations and those pillars so that we can, get things in motion. So yeah, and all of this, our conversation today was about health equity, but it can't just be, we can't just like we went over like, well, equality is this and equity is that, but like what are the things behind it? And that's really what the point of today's chat was about. So like if you're watching and you have questions, definitely feel free to reach out to us. Um, and before we go, like, do any of you have anything else to add? Because we'll definitely, health equity is always going to be weaved into our conversations. But I thought it was nice to, like, as like our first show after, like, in summer, to like, kind of give like a nice like refresher, like health equity. Let's talk about it. Let's give everybody a reminder. This is like what is weaved into the fabric of this show, because that's the truth. Um, so as you're watching, if you're joining afterwards, definitely feel free to make comments. If you want to suggest a show, you can reach out to us. Our information is in the description box down below. Make sure you hit that button to like, share, subscribe. But before we go, ladies, do you have anything else to add?
Sure. I always like to leave with a little bit of a charge, right? Because it's easy in this age of technology to kind of watch us and hear us and see us. And then the question is, well, what do you do with the information? Um, and so I just want to kind of go back to what I opened with, as it pertains to social determinants for health. This is really important. This is almost like you do, a self-assessment at times to determine, well, do you have the precursors for depression? Do you have precursors for hypertension? Do an assessment of your family. Where do you stand with housing sustainability, right? Where do you stand with food, transportation, your work or your economic standing? And then those are just a few of the areas. And then consider your family, your nuclear, go outside of your nuclear family to your extended family. And then consider your neighbors or the folks that you consider your sister friends or your loved ones. Where do they
Yeah.
stand? Because when you do that assessment, you'll be able to identify, like, oh man, you know what? If this happens, I can only make it for 60 days.
Right.
She can only make it from perhaps 30. And what does that mean? And how can you help prepare and have that discussion? Because those are the discussions that we need to have in order to really be united as a community, because you're
Mm-hmm.
only as strong as your weakest link. So just wanted to leave with that.
Mm-hmm.
That was awesome, Precious. So I don't think it's much more, but all I just want to say is, a closed mouth doesn't get fed, and so we know these inequities are there. We have a long way to go. So speak up, and if you have it in you to speak up for others as well, please do so, because there's some voices that aren't being heard. And if you're one of those people that are boisterous and strong and confident, and advocate for equity, then you do it for yourselves and you do it for thy neighbor as well.
Mm-hmm. So there we have it. So we're talking about making sure we have family, establish community, establish and maintain community, and then advocate for self and community. Um, right. So with that, we're going to end our show. Thank you so much for joining us. We will be back on July 11th. Make sure you catch us. We'll be going into maternal health, and Alia will be joining us, and we'll be talking about moms and what it's like to come back to work or work with newborns, and just that maternal aspect. Also in the month of July, we'll be having interviews with doulas. So it'll be awesome, awesome, awesome sauce. So that's our show for today. Thank you for joining True Health Live, and we will be back in July, and we'll see you in the forward. Peace, everyone.